Thank you again for joining our webinar, Introducing Anytime After Hours. I'll let you know that this is an interactive webinar, so feel free to enter some questions in the chat and we'll have some time for questions and answers at the end. This presentation will be recorded, so all attendees will receive a recording of the presentation tomorrow, which you're welcome to view and share with others. I'll start off by introducing our panelists today. We have Mick Connors, CEO and co-founder of Anytime Pediatrics, joining us. Dr. Connors is also a practicing pediatric ER physician. Next, we have COO and co-founder of Anytime Pediatrics, Angie Connors. And finally, our partner, Cayce Branyon, CEO and co-owner of Call Triage. Thank you all for joining us. We're very excited to introduce our new after hours offering. So we can go ahead and get started. I'll hand it off to Dr. Connors to tell us about how Anytime and Call Triage are modernizing nurse triage. Hi, Dr. Connors.
Hey, Darby, thanks a lot for that introduction. I really appreciate it. It's always great to surround myself with a lot smarter people like Cayce and Angie. So it's great to be on today. I think it all starts with kind of where Anytime Pediatrics came from. For myself as a pediatric emergency physician, this was kind of always my dream when we started Anytime Pediatrics, was how to get kids better care and get them connected to the right place at the right time with the right provider. So when we did our pilots 5 years ago, it actually was with nurse triage. And I think, as we all know, you just see so many kids that are coming to the ER from nurse triage that don't need to be there, or that don't even call a nurse and just come, because they have a runny nose or cold and a worried parent. You can go on to the next slide. So I think the biggest challenge, and one of the things that we always wanted to face with Anytime Pediatrics, is access. So patients need access to the care they trust. We know that 80% of after-hour nurse calls are based on parental worry and are made by parents. I mean, if you think about pediatrics, it's always the 80-20 rule, and we usually wind up in the 20%. But when it comes to after-hours access, pediatrics makes up 80%. We also know that families have kind of gone away from calling the office, just looking for that convenience, right? So they're worried they can't get the same day appointment. They might get phone advice, but oftentimes they're just going to places. I worked in a pediatric urgent care this weekend, and we saw 250 kids over 3 days, all with just primarily concern and fear. So I think that access to the practice and to the nurse triage is incredibly important, so they get the right guidance to the right care at the right time. Next slide. So I think the current way is always interesting as we look at, everybody's fearful of technology, and certainly in pediatrics, we're no different. But when you think about it from a parent perspective, trying to get access to their pediatrician, we've kind of been stuck in kind of the same old ways for a long period of time, where you call the office, you get transferred to an answering service, someone physically takes a message, sends it on to the nurse triage line, if that's the way that it goes, or the care advice nurse calls back. The nurse can see can hear the patient, can try to get mom to describe what's going on, what the child looks like. Are they dehydrated? Are they sick? And then if the nurse is worried, passes on to the physician. And as we know, that's less and less. Oftentimes, referred on to an urgent care emergency department because the child can't be seen. So it really makes it challenging for parents, because there's a lot of delay. So a lot of them don't even call anymore. The call numbers are going down. We also see, certainly I see in the ER, over referral for care, which is necessary. I mean, obviously you're working with your eyes closed and your hands behind your back, so you can't see that child. And so they're complaining of a sore neck, or if they have a bad rash, or mom's not sure what they are breathing like, you're going to send them on. And for what pediatricians, I think, don't always recognize is that they're losing revenue, because so many of these patients are referred on, even up to 40% with some nurse triage, are referred on to urgent cares or emergency departments that really probably could be seen in the office the next day. So you're losing your patients, and they're not using you for care, which is always the best care in my mind. Next slide. So when we thought about this from the get-go, and certainly now that COVID, is back, and sick visits are back, and kids have RSV and enterovirus, rhinovirus, adenovirus, all these kids are getting sick. The question is, how can you drive better outcomes? And is there a way that we can kind of revolutionize or transform after hours nurse triage? So we're grateful to Cayce and First Call Triage to partner with, because we really wanted a team of highly qualified and experienced nurses. They have a very low ED referral rate, even with telephone only. They're excited about the addition of video and images for nurse triage. So even if they don't pass it on to the clinicians, the nurse being able to see those images and the video is incredibly important. They now have that ability to route it on to the physician for a virtual visit, either that time or schedule it in the next day. And overall, we want kids to get the right care at the right place at the right time. So lessening referrals to the emergency department and other sources and trying to keep kids in the medical home, I think is the real opportunity around virtual care. So that's kind of my overview. And I'm pleased to introduce Cayce Branyon, who will talk about her incredible work at First Call Triage and the partnership that we're forming together. Cayce, I'll turn it over to you.
Thanks, Mick. I love that Mick says get the patient to the right care in the right time and place, because that's our goal at First Call Triage. We want to avoid those unnecessary ER and after hours visits. And it is exciting to partner with Anytime, because now we can see those patients. A little bit about the history of First Call Triage. Emily and I founded this company about 2 years ago. And after many years of being in the ER and seeing a lot of what Mick has been seeing, we would watch patients bring in, our parents bring in children night after night. And we knew we had the experience and we knew we had the education and the knowledge base to instruct these parents for the patients that didn't need to be there. And that was just frustrating in and of itself. And then we saw the physician side of things and how we could be a service to the physicians and how we could alleviate their burnout. You guys work long hours and you deserve a break. You need to go home and rest and not have to get up from the dinner table or step away from the soccer game or answer a call at 2 a.m. And so it was really a two-pronged approach in how can we service our community and empower parents to make good decisions to get their kids the right care at the right time in the right place, and how could we help the physicians. So that is where First Call Triage came about. When Emily and I left the ER, we went into telephone triage and did that for several years before starting our own business. And there were some things that we took away from that, some core values that we thought we would instill in our company and in our employees, and that would set us apart from others. And one of those is the quality of service that we provide. We eliminated the answering service piece. And so when patients call to First Call Triage or they call to your office, they don't know that they're calling a second party. They think of us as an extension of your office. And so they get a personalized message that they've reached their pediatrician's after hours nurse line. And our nurses answer those calls immediately. We don't send them through to an agent. We answer those calls live. And so when the parent starts to talk and tell what's going on with their child, they're talking to a nurse right away. And that's a big deal for parents. And our response time, if for any reason all of our nurses are tied up, and that does happen during high call volume times, such as Saturday mornings when everybody's calling the office, then they may have to leave a message. But again, it's a personalized message for your office. And then they're called back typically within 15 to 30 minutes. There are some higher call volume times that it may get up to an hour. And we just like to throw that out there to be open and honest, but we will not let it go over an hour. And so at that point, we're calling on additional staff. And then we have customizable plans to meet your needs. We want to be a service to the providers, and it doesn't work to have a cookie cutter approach to say this is what we offer and you either take it or leave it. So we customize the plans based on the hours that we take call for you. Do we cover holidays? Do we cover just 11 o'clock at night on? Do we cover anytime your office is closed? Do we offer standing orders for your office? What medications over the counter do you prefer that we recommend? So there's a whole list of things that we can do to actually meet your needs. And then another thing was the experience of the nurses. We knew that ER nurses made better triage nurses, and we wanted our nurses to have a minimum of 5 years experience between the ER or telephone triage. And that's made a big difference in our outcomes. And I'll show you that in a moment. And then the last thing is safe and accurate care. We record all our calls for quality assurance, and we also audit the calls each week. So we pull charts, we listen to calls every week on every nurse, and they're getting constant feedback, education, reinforcement from us to make sure that we're giving the correct care advice. And this is just some of the statistics and how we compare to others. We're using Barton Schmidt protocols within First Call Triage. And so we've asked them to pull all the other organizations across the United States that are using their protocols. And these are pediatric, either practices, after hours services, telephone triage. And these are the national averages. And this is how we compare. And I think that speaks to, again, the experience of our nurses. We send less patients to the ER, urgent cares, and we have more patients that are seen in 24 hours or more. So we're keeping those patients at home and we're getting them to their provider, whether that's in 24 hours the next day or see within 3 days when the office opens, for example. And I love what Mick said, because I say this over and over. Triage or telephone triage is like telling a nurse to assess a patient blindfolded with her hands behind her back. When we go to school, the first thing we're taught is to assess that patient from the time we enter the room. And we start that with our eyes, and then we touch them and we listen. And on the telephone, you have none of those things other than your ears. And you may be able to say to that mom, can you put the phone up to your child so I can hear them breathing? But other than that, up until our partnership with Anytime, we weren't able to see those patients. And we know that telephone triage is a risky business. And so there is that over referral, or there's the chance that we don't get the patient to the right place at the right time. And these are all examples of what that may look like. But with Anytime now, we have the option to convert these telephone visits into virtual visits. We can see the patients now, and we're so excited about that. We can ask that mom or that dad to upload pictures within the Anytime platform, and we can look at those. We can pass these visits along to physicians and say, can you see this patient? Do you have telehealth hours available? And let's keep this patient at home and out of the ER, out of the urgent care where they don't need to be. And so now with that option, we can see our patients, we can hear our patients, and we can really do a better assessment. We can do follow-ups. We had an example this weekend where the provider did a televisit and we followed up the next day and we looked at that rash, we looked at that swelling, we looked at that redness, and it's really a beautiful opportunity to take care of our patients and to take care of them well while providing the providers with a little relief in the after hours.
So I'm not Mick, but we're having some connection issues, so we swapped out computers. So I'm going to just talk a little bit about how we work with First Call Triage and really how Anytime After Hours works. So really, as Cayce and Mick both alluded to, this really is one of the best ways to be able to treat your patients in the after hours. So, the care can be accessed when the child is sick in the after hours. They really have two ways they can connect. One, they could go that traditional way. They could call the pediatric practice and they're connected to First Call Triage. And as Cayce mentioned, during that triage, they can be connected to Anytime. They can use Anytime Pediatrics to see that patient. But they can also access First Call Triage in the after hours through the Anytime Pediatrics app. So in addition to doing the phone call, they can go ahead and start that triage directly through requesting a visit. And so again, at the end of that visit, after they've either discussed it over the phone, whether they've had a video visit, there's a lot of outcomes that can be expanded from the end of that visit. One, they could be routed right then and there to their pediatrician for that telehealth visit. So, an optimal way to keep them out of the urgent care or the retail clinic is for them to be connected via telehealth to their pediatrician. And as Cayce said, maybe they don't need to be seen right away, so they can go ahead and schedule that patient for the next day right into your EHR. They could be routed to an on-call provider, or if needed, they could be referred to an urgent care and emergency department. And there really are so many benefits to really kind of enhancing the way nurse triage is now delivered, right? So the fact that the patient can be seen by the nurse and the physician Really, Cayce talked a lot about what you can see. We've seen instances where the rash, they've got a picture from the day before. Now they can see the rash today. That's a great way to see, does that child need to be seen right now? And that routing for the patient, if they're in the Anytime Pediatrics app, just like if you use it during the day, is very seamless for that patient experience. And really, as the clinician, you're only taking calls that can be billed in the evening. So if it's not valid for telehealth, they're not going to ask you to have a telehealth call, and hopefully you're going to have more free time and also generate more revenue for your practice. So why do people love using Anytime and First Call Triage? Really, hopefully, as I just mentioned, it's going to be less phone calls for your clinicians, right? But the phone calls they do get are when you're going to be able to bill for a telehealth visit. And you also now have the ability in your after hours to have video. As Cayce said, this is a great opportunity for them to enhance their ability to see the patients and to know when to move that on to the clinician. And this is that same easy access that your patients are used to, not only via the phone, but also via the Anytime app. Next slide, Darby. So this is really just kind of a brief visual that talks about really one of the things that's really exciting about the fact that you add telehealth to your nurse triage is the ability to create a return on investment. There are so many things you do in your pediatric practice that is just a cost. Well, utilizing Anytime After Hours with First Call Triage is a true return on your investment. And really the numbers break down based on studies that say of those after hours nurse triage calls, about 20% are valid for a telehealth visit, and about 30% can get scheduled the next day in your office for additional revenue. So if you go on to the next slide, Darby, we can really look at the fact that in a practice, you can see based on the number of clinicians, and if we say 20% are converted to a telehealth visit and 20 go to your office the next day, you're going to have an amazing ROI. And really that's without adding any additional hours if you're already taking phone calls that you're not billing for. So one of the things we'd love to do is we've got this ROI calculator. We can work with you on how many clinicians are in your practice, how are you reimbursed, what's your annual average payment for visit, to show you how you can actually not only cover your costs, but actually make money for your practice. So why do we think Anytime After Hours is really the right solution for your practice? Evenings and weekends can be triaged by our trusted partner. You as a clinicians are only going to be notified when it's necessary. It's amazing how many clinicians we've talked to in the last couple of months who are taking all of those parent phone calls. And I can't imagine how hard that is with how busy your practices are right now. I mean, we talk to pediatricians every day. They're working straight through lunch. They're working 12-hour days. I would think when you go home in the evening, you'd like to spend time with your family, have some downtime. And so by using this Anytime After Hours offering, you're going to be able to know that when you're reached out to, it's important that they talk to you as a clinician. You can drive that additional adoption for your practice. I mean, when your patients know that they're going to get a nurse and they're going to receive the appropriate care, they're going to be likely to reach out to you first. You can also, I mean, every pediatrician knows, if they don't know it statistically, they know anecdotally that you're losing patients to urgent cares and other competitors. And so by being available, you're going to decrease that leakage. And really, it maximizes the efficiency of you, not only the clinician, but also your office. So you're going to get a lot of data and a lot of information through Anytime After Hours that's going to make this a much more efficient solution for your practice. So one thing we like to talk about that is important, and I think Darby put in there, people are from all over. So one of the nice things for Anytime and First Call Triage is there's a nursing compact. So as First Call is covered in any of these states that are blue. So if you are in one of these states, that means your state is a part of the compact nursing licensor. And so that means that they have their license in all of these states. Now you can see other states are either pending or partially implemented. So if you are in one of those other states, please let us know and we can see if it's something that we're in the process of. I know Ohio says it's awaiting implementation. I know First Call is ready to go in Ohio. So please, if you're in one of those states that aren't in that dark blue color, know that it doesn't mean that we can't work with you, it just might not mean immediately. So Q&A, I'm going to pull Mick back in because he is one of the experts and give him his chair back. And we'd love to open this up for questions. So it looks like Christine's got a question. So I'm gonna...
Yeah, we're in Illinois, so it sounds like it says that state of Illinois is pending NLC legislation. So does that mean we're not able to do anything right now?
Cayce,
We would need to, yeah, we would need to look into that because there are others that are also pending. And sometimes that means that you can practice as a nurse outside of the state. They'll allow you to come into their state and practice, and others, they don't allow their nurses to practice outside of state. So when it's pending in that nature, we just reach out to the nurse board when we have an interest and say, what are the guidelines and can you work with us?
Okay, perfect. Thank you.
You're welcome.
So it looks like there's a question on do the nurses speak other languages, Spanish or Portuguese?
We don't, but we have a language line. So whenever we have a language that comes in that we do not speak, we put them on hold and we bring in an interpreter who helps us with that. And our language line has over 200 different languages. So we yet to run into one that we can't get an interpreter for. So let's hope that doesn't happen, but they have a lot to choose from.
And then there's a question also about collecting self-pay for patients. If they go through the Anytime system, we can on visits collect a time of service payment. So that's something we'd have to look at, but we do not do insurance verification through Anytime. So great question on how long does it take to get set up on any time after hours? It's actually a relatively quick process. You know, for current Anytime customers, it's super fast because we really just need to add this to what you currently have. So there's an onboarding sheet that really helps Cayce and her team know what you guys want to set up in your practice. So what are the hours? What do you have standing orders? How do the doctors want to be contacted? And once that's done, we use that to kind of have a kickoff call and get you going and you can get started. If you're new to Anytime Pediatrics altogether, then we also would need some time just to make sure you know how to use our platform for telehealth. But really, either way, we can have you up and going in a matter of a couple of days. There's another question from Dr. Hines on where the percentages on the converted numbers. Those came from some studies. I think they were actually Dr. Hines from Barton Schmidt. Mick just walked out, but those numbers, on average numbers converted to telehealth in the office the next day. Where did those come from?
Yeah, that's from Barton Schmidt. And I think, you know, going forward, what we're finding, I think with Cayce and her team is that likely even less will be referred to the on-call physician because they'll be able to handle it better with video. So yeah, that's how we kind of came up with those. Certainly every call line is a little bit different as far as their experience, but I know with Cayce's group, only about 5% are referred on to the emergency department, even with telephone. So our hope is to really keep them in the medical home.
So I think Darby is launching a quick poll just to ask you guys a few questions. We really appreciate everyone participating in the webinar today. We'd love to talk to your practice about after hours. As you can see, we've got an amazing partner with Call Triage. So we're really looking forward to, we already have some customers up and running. So we've had great feedback from, their experience. So we'd really love to work with you with Anytime After Hours. There was one additional question, Cayce, you might be able to answer. It says, are patients reluctant to speak to a nurse they don't know if they are used to talking directly to the clinician?
Typically, they are not. We run into that a good bit, and that is a concern for some practices, especially for providers who have been taking their calls for so long, and the patients are used to getting a clinician. But once we talk with them, and I don't know if you guys are accustomed to the Barton Schmidt protocols, but the wealth of knowledge there, and when our nurses get on the phone and start asking questions and giving care advice and telling these parents what they can do that will be helpful to them, you will find that they are very appreciative. Our offices talk about how their parents come in and tell them about the after hours nurse that they spoke with the night before or 2 to 3 nights before, and how helpful the information was. So we don't typically run into that problem at all.
Great, thanks, Cayce. So again, thank you guys so much for joining. We really appreciate you taking the time. I know all your practices are super busy right now, but I think if you look, Anytime After Hours can really help lessen the stress that everybody's going through, especially giving clinicians a little bit of downtime and keeping patients connected to the medical home. So thank you again for participating.